And welcome to the Dr. Bob Show. We'll be spending most of this show talking about how good your bony architecture is. How strong are your bones? How weak are your bones? How good shape are your bones? Are you eating enough calcium? Is there enough calcium in your bones? What foods have calcium? How do you know if you don't have enough? Are there any tests for that? We'll be spending most of this show talking about your bone strength. My guest is Dr. Bill Law. Dr. Law is a board-certified endocrinologist, and he'll be answering our questions about how strong our bones are. Hello, I'm Dr. Robert Overholt, and I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about the quality of air that you and I breathe in when we go outside. Can it be dangerous, and what should we do? And is there a simple test that we can measure for hardening of the arteries? Or do we just have to pay attention to different body functions? A lot of information for you. You'll want to stay tuned. We're talking with Dr. Bill Law, board-certified endocrinologist, and we're talking about bony architecture, soft and hard bones. Bill, welcome to the Dr. Bob Show.
Thank you, Bob.
Tell me about osteoporosis. What does that word mean?
It's a term used to refer to weak bones that won't bear weight, that are more prone to break. And that's where the rubber meets the road, is fractures.
So then it's a huge problem? Do a lot of people have osteoporosis? A lot of fractures because of that?
Actually, the statistics are amazing.
Oh.
There are somewhere in the range of 15 million Americans with osteoporosis. Your likelihood of having a hip fracture is greater than your likelihood of breast, ovarian, and uterine cancer combined if you're a lady age 65 or older.
And I remember back in the old days that a hip fracture used to be sort of a death sentence. Not so much now, but is it still a problem?
The way the actual data falls is that if you have a hip fracture, your likelihood of dying in the next year is about roughly 20 or 25%. Now, to put that in perspective, that's equal to your risk of dying in the first year after a heart attack if you survive the initial hospitalization.
So it's really a pretty big problem. How does somebody know if they've got osteoporosis or how strong their bones are?
Well, that's the problem. Osteoporosis is a silent disease. You have no idea how strong or weak your bones are until
crack.
You break. It's like that last step off the edge of the Grand Canyon. So you got to be looking for trouble. You have to get checked to see how strong your bones are, so that if you got a problem, you can initiate appropriate treatment and get off the track before the train hits you, not after.
So how do you check?
You have to have what's called a bone density test, or DEXA, for dual energy X-ray absorptiometry, but it's DXA is the medical term for that.
And what does that do? How does that tell you if you got soft bones or not?
Well, it actually measures what's called the density of the bone. And it's real easy. It doesn't hurt. You just lie on the table and the machine scans down your spine, and then you change position and it checks your hip. Spine and hip are the two most important areas.
So how do we know what person is more susceptible to having osteoporosis? Are there anything that makes us think, uh-oh, we better test this person? Is it age? Is it sex? Is it lack of activity? Is it other disease process? What makes us think we need to get a DEXA scan?
Well, you were asking the question, is it this, 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 and this? My answer is yes. All of those plus some. I think we all know those little scrawny people that are real active. They can eat half of your supper and all of theirs, and they still stay skinny. People you love to hate.
Yeah.
Those are the people that are most likely to get osteoporosis.
Why is that?
Because they have small bones.
And when
you start out with small bones, you don't have nearly the cushion, if you will, the forgiveness factor. You only get up to a certain point, And then, you know, they say it's all downhill after 30. You get the maximum bone strength at about age 30, and then with a lady, you stay about the same until you lose the protective effects of estrogen at menopause. And then you start steadily losing bone. So if you're a real skinny, small bone person, you only get bones that are this strong, so you're not very far from the edge of that cliff.
So when you go through menopause, you lose more calcium out of the bones?
Mm-hmm. The estrogen protects bones.
Can calcium replacement at that time help people? What do we do to keep them from protecting their bones?
Well, clearly if you have adequate calcium intake, which means about 1,000 milligrams of calcium a day, say 4 glasses of milk a day. How many people you know have 4 glasses of milk a day nowadays?
I have a glass for breakfast.
You and I had a glass every meal, but many people now don't have milk at all because of the calories or because they have lactose intolerance, milk sugar intolerance, or maybe they just don't like the taste, whatever. But low calcium intake is very common, and the problem is you're going to lose calcium every time you go to the restroom. You pass calcium out of your body, and if you don't replace that, the body's going to do whatever it takes to keep the blood calcium in the normal range, and if you don't replace it by calcium coming in from the gut and calcium that you absorbed, which takes vitamin D, that's where vitamin D comes in. If you don't replace that, your body's got no choice but to suck it out of your bone stores. So getting adequate calcium intake and adequate vitamin D to absorb it is very important. It'll slow the rate of bone loss down, but it won't actually prevent it.
Are there cells in the bone that help keep the bone structure normal, we'll say?
Yes, very much so.
How does that work?
Well, we think a bone is just sitting there, but nothing could be further from the truth. Bone is a very active tissue. You're constantly chewing up bone and building bone back. It's like being in the Army, where they say to the private, dig a hole, fill it up, keep busy. Well, that's what's going on in your bone all the time. Millions of little bone-forming units all over the skeleton. And the problem with osteoporosis is if you dig that hole and then you don't quite fill it up, and you have millions of those things going on at the same time, you end up with steadily weaker bones.
So, and that's what we call osteoporosis.
Absolutely.
So at what age do we start thinking about osteoporosis, and what age do we test people for? You talked about post-menopausal, but how about young people? How about people with illnesses?
Well, the bottom line is we're interested in fractures. And the younger you are, even at the same bone density, the less likely you are to fracture. You could have, say, a 50-year-old with a bone density of this, and their likelihood of having a fracture is much, much, much less than an 80-year-old with exactly the same number. So there's more to it than just what the number is, the bone density measurement. There are a lot of other things like general strength, balance issues, visual input for balance, other medical problems that can impact your likelihood of falling and or fracturing.
So does activity help bones, or does it make them weaker? If we're running around and we're using our bones, does that make calcium come in, or is sitting down and you wait for the calcium to come in the bones? Which is best?
You know that old saying, use it or lose it? That applies to bone. Being physically active, and not anything, you don't have to work out with a trainer, just walking is excellent activity to give your body a reason to invest resources in the bones to keep them strong. If you just lie around, your body's going to take those resources and put them elsewhere.
So sometimes, is that why somebody that's heavier, they put more bang on their skeletal tree than the little lady that we talked about that really doesn't have a lot of weight to tell the bones they need more calcium? Would that be a good analogy?
Well, actually what happens, the heavier people tend to have heavier bones, which gives them some cushion against a fracture, but it tends to wear out the joints between the bones. They get arthritis, and that's where the pain comes from. I mean, if we could figure out a way to make everybody have horrible pain in their side every time their bone density got low, oh man, we fix osteoporosis. But the problem is, it doesn't hurt until you fracture.
Okay, is there good treatment to prevent osteoporosis? And if you get it, is there any way to treat it?
Yes, sir. We have a lot of good medicines available.
And that's what we're going to be talking about when we come back. If you have osteoporosis, there's lots of good medicines to treat it and to prevent it. You'll want to stay tuned. We're talking with Dr. Bill Law, board-certified endocrinologist. We've been talking about osteoporosis, about not having enough calcium on the bones. The big problem is fractures, and there's no symptoms of osteoporosis. Crack, the hip is broken, or there's a fracture of the back. Those are common areas. So now we're going to talk about what we can do to prevent and what we can do to treat. First, Bill. What conditions predispose somebody? What kind of illnesses predispose to osteoporosis?
Well, one of the big ones is treatment with steroids, prednisone, Medrol, and in high doses. You know, the kind of things that you do patients with allergies. You know.
With asthma sometimes.
Asthma. And then a lot of conditions with malabsorption, things like celiac disease, or people that have had bariatric, weight loss surgery, they can have low vitamin D and low calcium absorption. Things like rheumatoid arthritis, other bowel conditions like Crohn's disease. So there are a lot of things that can predispose you to it. If you have a family member, like your mother had a hip fracture, that's a big risk factor. Those apples don't fall too far from the tree,
So those conditions, we need to get a DEXA scan so we can begin to decide what our treatment should be. What does osteoporosis look like in a bone? That's a leading question because I see that you've got something beside you.
I just happen to have a little model here.
So what is that of?
This is actually of the spine from the outside.
And you can get osteoporosis of the bones of the spine?
Big time. And you can collapse vertebrae. And this is what, if you sliced it down, you might see. And you can see up in here, these bones, it's a nice, tight calcium, looks really, really thick and hard and strong. Then as you move down, it gets more like moth-eaten. Big holes start showing up. It's not near as dense. It won't bear weight as much.
And
it's likely to fracture. Yeah,
is that what a fracture looks like?
Yeah, this one is collapsed on the front because you're bending forward, so you put more and more weight on the front part of that vertebrae, and it's just like a pile driver, just cracks it down.
So that's why
you can't make it go back up.
That's why they call it a compression fracture.
Yep, that's what it is.
And
Because all your body weight up, your head and your chest is all pushing down on that.
When you take an X-ray of the vertebra, do you get a hint that there may be osteoporosis? I know you've got to get a DEXA scan.
Just a plain X-ray, it'll show you fractures, of course. And if you have really low, really weak bones, a good radiology doctor can tell you that the bones look a little washed out, they'll call it. But X-ray itself is not a real sensitive way to pick up osteoporosis. You really need that bone density study, the DEXA scan.
So let's look at some of the vertebrae on the upper part that are in good shape right there, and they look like it's in a healthy bone, healthy person.
Yeah.
How do we keep that healthy in that person? Let's just say, is it just calcium replacement? What do we do? What do we tell them?
Well, you need to be sure that you have adequate calcium. You have to have enough vitamin D to absorb the calcium, and then you have to stay physically active so your body has a reason to put that calcium in the bones and keep them strong.
That sounds pretty simple.
Pretty simple.
You
don't have to be real smart to be an endocrinologist.
Yeah, you do. But you got to have a compliant patient that does what you tell
Doesn't
them.
work if you don't take it.
Now, in the middle of the spine that we have right here, the bones are osteoporotic. There's a lot of gaping holes in them. That's osteoporosis. How do we treat that? It's just not calcium replacement.
Right. Well, you want to try and prevent fractures.
That's the key
The
word.
biggest risk for having a fracture is already having a fracture. It's like they call it a cascade effect. It's like dominoes. all those dominoes sitting upright, as long as they're all upright, no problem. But if one of them falls,
the other ones keep falling.
it makes all the others fall. It's a progressive cascade effect.
So how do you
the
make
key
those,
is to prevent that first fracture.
how do you make those bones strong? How do you prevent that first fracture?
Well, you got to have calcium, you got to have vitamin D, you got to have physical activity. Those are givens. Then there are a whole bunch of medications that have been proven in clinical trials to significantly strengthen the bones and decrease the likelihood of having a fracture. And there are a whole bunch of different classes of medicines. Female hormone, estrogen, as I said, it's very good. So if a lady, goes to starts into menopause and then starts female hormone right then, you can basically prevent the usual bone loss you would see as long as they take the estrogen. And I have some ladies that are in their 80s that look great and they got really strong bones and you couldn't steal their estrogen away. But they're like any other medicine. There are some pros and cons of estrogen, and they need to talk to their doctors about that.
So if they can't or shouldn't take estrogen, what other medicines put calcium on the bones? If you've got osteoporosis that heals it, takes care of it, treats it, gets it better.
Well, the two first medicines were called miacalcin, which is a spray, and Fosamax. Miacalcin is not a real strong agent, and it's expensive and a lot of trouble, and I wouldn't recommend anybody using that nowadays. Fosamax is a very effective medicine, and there's another one called Actonel, another one called Boniva, and these have all been around so long that they're generic, so they're pretty inexpensive. The problem is that they are a lot of trouble to take because they're very poorly absorbed and very caustic, very irritative to the stomach. So you have to take them when you first get up with like 12 ounces of water. So you tsunami those things through the stomach, doesn't just sit there and eat a hole in it. And then you can't do anything else, no food, no other medicines for at least an hour.
You have to sit up straight?
You have to sit up straight so that you get it draining the right direction. And some people still, they get some stomach upset with it, or they may get some aching all over. So some people don't tolerate them well. But if you can take them without stomach upset and without the achiness, they're very effective in decreasing both spine and hip fractures.
That's Fosamax, that's Boniva, and Actonel.
They're all very similar in terms of their activity. And then there's a real long-acting medicine in the same class that was called reclassed, or it's now generic, so it's called zoledronic acid, and it's really potent. It has a stronger fracture reduction than any other medicine that's been around, and you just give it as a once-a-year IV. You just put an IV in, infuse it over about 20 minutes, you're covered for a year.
So it sounds like, to me, that'd be the easy way, the treatment of choice. That's called reclassed.
Well, or zoledronic acid now because it's generic.
It's generic.
The nice thing about it is, for a lot of patients, they're not real rich. And some of the newer branded medicines can be fairly expensive. But because it's the reclassed is given in a doctor's office or in a hospital outpatient facility, as opposed to having to go to the pharmacy and pick it up, because you have to give it IV, it's covered under Part B Medicare, as opposed to the prescription benefit. And so for a lot of people, if they have, Medicare and a backup policy, it's completely covered. So it's easy and cheap.
A new medicine, Prolia. What's it?
Now, Prolia is an excellent medicine. It's a newer one, so it's not generic, so it's quite a bit more expensive. But it's a completely different class. It's also real long lasting. It's just a shot. You don't even have to have an IV in. Just have a shot every 6 months.
So that's pretty good too.
And again, if your doctor can provide it through their office and give it there, again, it's covered under Part B. You can just get it at a pharmacy and take it to the office and have the doctor give it. That also, works. But it is at least as potent as the IV reclassed, but it's just a shot. And the thing is, it doesn't last a real long time, though. Once you get to 6 months, its effectiveness starts dropping off. So you don't want to not take it. Whereas the reclass, you can give it for maybe 3 or 4 or 5 years in a row, and it builds up in the bone, and then you can take a drug holiday, and it'll keep your bones strong for several years frequently before they start drifting down again.
Your advice to people on having good bone structure and not having osteoporosis?
Most important thing is to pick your parents right.
Okay. So your heredity is important.
Heredity is
Second
very
most
important.
thing is think about it.
Think about it. Ask your doctor to think about it, because it's a silent disease. And you go to the doctor, you're complaining of a cold. Doctor's not going to think about checking your bone density. You have to kind of help the doctor out and say, I'm really interested in knowing how strong my bones are. It doesn't hurt until you fracture.
And then he has to get a DEXA scan, and from there you can make treatment decisions.
Absolutely. You want to know what you're treating, because some people amazingly will have really good strong bones and they don't need to incur the expense and inconvenience and potential risk of taking a drug.
Bill, I love to listen to you teach. You're such a good teacher.
Well,
and
thank
I
you.
always appreciate you coming to the Dr. Bob Show, especially the important topics that you discuss, and today's was very important for people. Thanks.
My pleasure.
Remember, think about your bone density. Talk to your doctor about it. He can get a DEXA scan, and then you know what to do. You're going to want to stay tuned. We've got a lot of information for you talking about the air we breathe in. Could it be dangerous when you breathe air that's outside? And is there a simple test for hardening of the arteries? A lot of information for you. I want to thank Dr. Bill Law. Wonderful discussion on osteoporosis. Think about your bones. Think about a DEXA scan. Talk to your doctor about it. And now questions from you, the viewer, that I think will be important to your health. Question number 1, Dr. Bob, why is the air that we breathe in sometimes bad for us? Well, that's called air quality index. There are 5 particles in the air that can cause problems with your health, especially if you have lung problems, especially if you have heart problems, but they can make it difficulty for even young people or workers. So what are those 5 things? Number 1 is ozone. Ozone at ground level is hyperoxygen, and it causes irritation to the airway. Number 2, particulate matter, little small particles that are activated. When they get in the lungs, they irritate the lungs, and it predisposes us to having asthma attacks or bronchitis. Also, increased incidence of heart attacks when there's increased particulate matter in the air. Sulfur dioxide and nitrogen dioxide, 2 substances that when you combine with water will form an acid, and the acid irritates the lungs. And the 5th one is carbon monoxide. Out of the mufflers of cars comes carbon monoxide. When we breathe in carbon monoxide, it has a high affinity for hemoglobin, throws the oxygen out of the way. We don't get enough oxygen for the body. So know that air pollution can be bad for your health. If you know there is a poor air quality index in your area for a week or for a day, spend more time inside where there's air conditioning, spend less time outside where you're breathing in air that can harm your health. Question number 2, Dr. Bob, is there a simple test to measure hardening of the arteries? Well, let's talk about hardening of the arteries. The arteries are very elastic substance. What can make them hard? Well, if cholesterol goes into the vessel, the cholesterol that swims around the bloodstream, especially the LDL, the lousy cholesterol, the bad cholesterol, it can be grabbed up by certain cells, macrophages, oxidized, they form foam cells, and that deposits cholesterol in the arteries. When the cholesterol is in the arteries, then we have hardening of the arteries. That can occur in the coronary arteries, that can occur in arteries that are in the abdomen, that are going down to the legs. There's no vessels that can't have hardening of the arteries, cholesterol deposition. So know what your cholesterol is, stay active, try and raise the good cholesterol, and if you're low cholesterol, your LDL, If that is too high, then there are medicines that can bring down the LDL. That's all the time that we have for this show. Let's remember those 4 things that we like to talk about on the Dr. Bob Show. Number 1 is exercise. Can't tell you how important it helps fight off osteoporosis. It will improve lung health. It will improve heart health. It will decrease stress. It will help us lose weight. It will help get rid of some sodium that's causing high blood pressure. So know that regular exercise is one of the best things that you and I can do to stay healthy. Really doesn't matter the kind of exercise. It can be swimming, it can be gardening, it can be bicycling, it can be walking, it can be climbing stairs instead of taking the elevator. Be sure that you get 30 minutes of exercise at least 5 days a week. 8 hours of sleep. Now we think 7.5 hours may be all we need. Be sure that you're setting your clock where you get 7.5 good quality hours of sleeping. If you don't have quality sleep, then talk to your doctor about what's the problem. Is it pain? Is it medications? Is it snoring? Is it things that are keeping you from sleeping well? Eat well. We eat too much food. We're marketed to eat food. For breakfast, have fruit and fiber. A little salad for lunch. Have a light supper. And then most of all, what is it we like in the Dr. Bob Show? It's that laughter in your life. I can't tell you how important it is. It'll improve your immune system. You'll be healthier and happier, and so will your neighbors.